So, welcome everyone to Climate Health Now Action Fund's really conversation and space to get involved in the campaigns that we're involved in this year. And this is really going to be focused around members of our advocacy campaign teams who are here as our co-presenters. As folks will recall, Climate Health Now, we're a 501(c)(3), but this presentation is through our 501(c)(4), our sister organization, Climate Health Now Action Fund. So today we're just going to start with some intros. We're going to do a brief overview of our advocacy campaign team members and our advocacy advisory team, kind of speaking to how we're structured, talk through our policy platform, and then really get to the core of our presentation, which is just having our advocacy campaign team co-leads talk us through ways in which folks can take action and get involved in the various campaigns that we're supporting this year. So we have two wonderful volunteer teams. As folks may or may not know, Climate Health Now Action Fund has roughly 900 plus health community members throughout the state of California. So all of our teams are volunteer led and run. And these are our two advocacy campaign teams, Climate Avengers and Fellowship of the Green. We got some fun names here. And they are going to lead us through the actions a little bit later on. So just to put a face to our teams, we have Climate Avengers, we have Wendy, Michelle, Hannah, and then Fellowship of the Green, Rachel, Keegan, Rachel G, and Chelsea. And then we have our team coaches, Lisa, who really is involved in a lot of 350 actions work and has some deeper legislative experience. And then our co-founder, who's also present with us on this call, Ashley McClure. And myself, I'm one of two part-time employees at Climate Health Now / Climate Health Now Action Fund. And yeah, it's great to be with you all today. So our advocacy advisory team members really guide us and give us support and advice on which campaigns are most pertinent. And we move through a process with our members to discern where our members' interests lie and then align them with kind of what's happening in the state and where we really see this nexus between climate and health issues. So we move through a process of having meetings with them to determine which bills we want to support or oppose that are climate and health related. And of course, we're really grounded in our policy platform, which is the US Call to Action on Climate, Health, and Equity. And you can read more about that here. And now we're going to move on to just taking action together and learning a little bit more about our campaigns. And I will pass it to Rachel G, who's going to open us up with a reflective exercise.
Hi, everyone. Can you hear me okay? Okay, awesome. I just want to start our time acknowledging that, there is in advocacy, there's also a helpful space for pauses and for reflection too. And specifically, I wanted to do an exercise to kind of foster joy and sharing together. So let's go to the next slide. Okay. Oh, yep, there we go. Okay. I think part of fostering joy is being able to name when two otherwise contradictory things can be true at the same time, or naming duality. I have two pictures here. They're both submitted actually to a medical humanities journal that's available online. It's called Pulse. Um, and they are pictures that were sent in by peoples of like healthcare community. One is a picture of a flower with like holes in it, and we'll get it back up in a second. But I'll Here we go. Okay, so one is called Tattered but Still Beautiful, and kind of acknowledging that like sometimes in advocacy, we get hit a couple of times, but there's still beauty in like the labor that we're doing. And then at the same time, there can be other periods of time where we feel like the breath of life image, where we're flourishing, growing. It feels natural and easy, like breathing. And we feel like, we're succeeding at things. So if we advance to the next slide, I just wanted to have like a little bit of sharing for a couple of minutes. People can either like type in the chat or unmute themselves because it's a pretty small group. What's one way? Can you name one way in which you're flourishing or one way in which you are resting in this season? Or which picture do you identify with more in this season?
I really like the azalea with the holes in it. I think that, yeah, I can really identify with that right now. And I love that you're just even bringing this up, because one of my friends recently was talking about just like what we decide to put our attention on. And we could just look at the holes, but there's also the beautiful flower. So I'm trying to just look for the good and look for the beauty, and ignore the rest a little more. So yeah, it was fun.
Yeah, definitely. I think the reframe is always helpful. That sometimes we focus on those little holes, but if we back up, there's beautiful things still happening. Just want to read some of the things in the chat. So Rachel A was mentioning reading, running, gardening, and also kind of identifies with the beautiful mess that is the left-hand side. And then William was mentioning that he's flourishing with Prime members for a cleaner Amazon, has some sustainability meetings coming up. That sounds awesome. Keegan is flourishing with your community, where Talitha is resonated with the tattered but beautiful. And I'm glad that you're thinking about ways to um, to foster into real plants for my future. I'm assuming you're fostering in plans and or plants into your well-being, which I support both of those journeys. Reading, meditation, outdoors. I think I'm also part of the tattered but beautiful um, grouping right now. And I think rest for me this season has been just like, yeah, spending time with loved ones and cooking things just for the joy of it. Thank you everyone for sharing. I really appreciate it. I think we can probably continue on with now the action component. And thank you all for reflecting together.
Thanks, Rachel. I'm another Rachel. I do appreciate those sort of like intentional meditative times, even a few minutes every day, because I think that it helps us refocus on the big picture. So thanks, Rachel. So we are, just for anyone that's generally not following the legislative cycle really closely, any of the bills that are being presented today have kind of made it through the first hurdle of their first chamber that they were presented in, and they're now making their progress through the second chamber. So the main bill that I'm following right now was started out in the Senate and is now in the Assembly. It's called SB 1075. I'll say more about that in a second, but it really focuses on reducing air pollution in environmental justice communities. And air pollution can be like direct fossil fuels, but it's primarily a bunch of different types of pollutants from the burning and processing of fossil fuels. So just wanted to give a really brief overview of like that includes PM 2.5 and PM 10, and then also transportation related air pollution, like on the right, like VOCs and nitrous oxides. Next page. So just a few facts. There is a lot of literature about this, but this kind of will kind of summarize things pretty quickly. So Black, Latino, and low-income communities are some of the environmental justice communities, and they're consistently exposed to higher levels of air pollution than white and high-income communities. And this is primarily due to systemic, like typically racist patterns of redlining and disparate siting, in which freeways and high polluting industrial facilities are essentially placed in existing communities or communities build up around these because the housing is more inexpensive. Next page. So, um, so I like this graphic. I'm a family medicine physician, and it really shows how air pollution affects people at every single stage of life. So pregnancy and in the womb, children, adults, and then our vulnerable elderly population as well. But as you can guess, our environmental justice communities are even less healthy at baseline due to these systemic practices and poor social determinants of health, and therefore they're more affected by air pollution. And there's significantly higher prevalences of hypertension, diabetes, obesity, chronic kidney disease, mental health disorders, prematurity, low birth weight, stillbirths, and a variety of neurodevelopmental outcomes, and cancer, of course. Next page. So I found this pretty cool study. It was like an associative study, but it shows that when you decrease air pollution in a community, the people that are most benefited are environmental justice communities. So specifically like Black and low income populations, their mortality benefits nearly doubled that of white high income populations when PM 2.5 exposure was reduced by 1/3. So pretty powerful how we can focus on these communities that have historically had a variety of environmental inequities and heighten and try to level the playing field a little bit. Next page. This is a lot of wording, but basically there was back in 2017, there was a bill that passed that said, hey, let's do something about this. We're going to try to improve air quality in environmental justice communities by monitoring and reducing emissions. Well, guess what? It's not happening. And mostly because the regulations are not holding these governmental and community organizations accountable. So SB 1075 would require that these local governments that have these community emissions reductions programs actually integrate emissions reduction standards for every single land use decision. And they'll also maintain active community-based steering committees with oversight until these goals are met. And it also establishes like reporting standards on measurable outcomes and essentially increases transparency and accountability. So what we can do about this, currently it's in the assembly. It's going to either go to local government committee next or national natural resources. It'll probably jump through both. My contact with the staffer whose senator proposed this and wrote this bill has indicated. So what we're going to do next page.
I see Bill's hand is raised also. Rachel,
Oh,
I don't know if you
sure.
want to.
Go ahead, Bill.
I don't know if it's okay to interrupt. Thank you. I'm
Absolutely.
just curious, practically, how would this work? I understand you have these committees to work on land use decisions, but actually, how is air pollution going to be decreasing these pollutions that already have these fixed sites that would require very expensive retrofitting to change their pollutants, for instance?
So my understanding is that this would be it probably does require some retrofitting, but my understanding is that it's going to be for like in development, like land use plans initially. So like things that are actively evolving within the community, like you're going to tear down this and you're going to build this factory instead. Those will be the things that will be addressed first and foremost.
So to address further development in impacted communities, is that the gist?
Yeah, that's my understanding. And I imagine that they'll start going backwards too to start, as you say, retrofitting, but the first priority will be those that are new developments.
Thank you.
And then Vanessa also asked who the author is.
Oh, it's Reyes. I can get her first name. I think it's like Elise Reyes.
It's
Rachel,
okay.
I'll work on it. You keep on going.
Okay, thanks.
Yeah.
So our first action, and I was going to put these into the chat as well, so for ease of use. So give me a moment. If you don't already know your assembly member, and again, we're focusing on the assembly just because that's where this bill currently is, then you can find your assembly member here. This first one that I'm putting in the chat. Um, if you then find your assembly member and then go through these other two committees, I'll put these in the chat too, the Natural Resource Committee and the Local Government Committees. You can see if your specific, excuse me, you're, sorry, very bad at multitasking. So you can see if your assembly member is on either of those committees. If they are, excellent. That would be your action is to call their office. Ideally, right now, Whitney, do we have time for that?
Yeah, we have time for that. We
Perfect.
have till 12, we have at least 5 minutes, so yeah.
Excellent. So I'll put these all in the chat as we're going. So ideally, you're identifying your own assembly member from either of these committees if they are in them. If they're not, then you would call the chair of one or the other. You pick whatever you have time for. If you could have time for both, excellent. And if you are a constituent, within that little script there, if you could also say, I'm a healthcare professional, you can say I'm a physician, a nurse, a chiropractor, whatever your title is, and a constituent. That is the goal. Putting all of these in. So for example, I'm down here in San Diego and my my assembly member is on the local government committee. His name is Ward, so I'm going to give him a call. So what we did last year is we all went on mute and we just did a 2-minute call to the respective office. And again, if you don't see your assembly member, just please call the chair of one or both of those committees. Does anybody have any questions before we do our action? Awesome. Let's call them. Oh, and the phone number is in the list of members from each committee. We'll all come back at like 2:50 or 12:55. Okay, we'll give everybody about 20 seconds unless everyone is done. I see some folks are like not, they're still off video, but
Yeah, I did the voice message
okay.
because, yeah, and then that's okay to do. I know.
Absolutely. Yeah, absolutely. Thanks, Vanessa. Yeah, I had someone live pick up, so I find it interesting that depending on who I call, they get more or less information from me. So it makes me feel I'm curious what representatives actually take into account more than others, what their constituents are calling about. But good news that my assembly member got collateral information for me. So that's a good sign of engagement, I think. And thank you, Whitney. You also called Buffy Wick's office. Yay. Okay. I am going to pass it next to, I can't remember if it's Ashley or Keegan. Keegan.
To me, which is a good transition because my issue is also environmental justice related. So there's going to be a little bit of overlap, and then at the end, one of our action items is essentially the same one. So maybe we'll pin that for tomorrow on your guys' to-do list. But to have a little time with you all, I'm going to talk about plastics, a big category in terms of environmental pollution and environmental justice. And one way to think about plastics is as a category, as a classification. It is basically just synthetic materials made from organic polymers, which doesn't necessarily mean that it's made from non-renewable fossil fuels, but about 99% of them are. So when you're looking at this plastic life cycle, just know that the majority of plastics are coming from crude oil and natural gas. And that production is increasing. Since 1950s, we're producing about 20 times more plastic than we previously were. And there's projections, we're currently producing hundreds of millions of tons of plastic per year. And there are projections that estimate will go up to about 1.2 billion tons by 2060. So this is a large manufacturing collection and is projected to get larger. And just for some references, in 2010, there was about 8 million tons of plastic measured in the ocean, and that number has only increased. So as you might notice in this plastic life cycle, there is a small little arrow kind of heading back from disposal to manufacturing that is supposed to account for recycling. Less than 10% of plastic that is made is recycled, and less than 1% of that plastic is recycled multiple times. So where does this plastic go? About 50% of it ends up in landfills, 20% of it is burned, and 20% of it ends up in oceans and in the environment. And for us locally, we've generated about 2.9 million tons of plastic, single-use plastic, in 2023 alone. So we are definitely contributing to this life cycle and pollution cycle. And you might notice in every single step of this stage, there is certain elements that might be related to fossil fuels or greenhouse emissions. If you were to take the global emissions of plastics, it's comparable to the third largest producer of greenhouse gases as a country, similar to the country of India. So this is a huge impact on the environment, major contributor to air pollution, like Rachel was talking about, and has a lot of harmful impacts on people outside of that as well. Next slide. So to focus a little bit on the plastic burden itself, specifically in California, this is a tool made by UCLA Luskin Center that just measures the density of pollution in certain areas of California. The darker blue it is, the more pollution from plastics is in that area. And despite its status as a leader in decarbonization, California continues to host a large amount of fossil fuel extraction operations. Its production's small on a national scale, less than 1% of the output, but we do produce about 112 million barrels, or at least we did in 2023, and that's the 7th highest state total. Like we mentioned, plastics and fossil fuel extractions kind of go hand in hand. So as we move away from fossil fuels, plastics has become kind of that backdrop for petroleum companies or fossil fuel companies. So California is also home to about 14 petroleum refineries, about a tenth of the national refinery capacity. And we ourselves contain about 10% of the nation's plastic manufacturing establishments. Within the state, it's a very small amount of our manufacturing, less than 5%, and doesn't employ a lot of people. So it's not like it's a large part of our production, but it does do a lot for the nation comparatively. And these numbers are projected to increase. As I mentioned, plastic production is projected to increase. So that would also be the case for us here in California. So we have lots of pollution within California where these oil and plastics are produced. And because of kind of what Rachel was talking about, these historic patterns of zoning ordinances, redlining, and segregation has resulted in higher rates of hazardous waste and other toxic facilities in low income and communities of color. So you might notice some of that on this slide already, but we're going to talk a little bit more about it. And studies have found that this toxic exposure is shaped by racial disparities. Even when you control for things like income, it is more likely that illegal dumping sites or external waste will be offloaded in communities of color. And the next slide is going to point out a little bit more of that. So if those of you who aren't familiar, on the right now, I'm showing the CalEnviro screen, which basically identifies California communities that are most burdened by pollution, and then also considers things like health outcomes and socioeconomic characteristics. So the more red or orange those colors are, those districts are, the higher they are burdened by pollution, health outcomes, and underprivileged areas. And you can see there's a fair amount of overlap with this plastic burden and the burden of all these different factors with the CalEnviro screen. So, for example, this study in UCLA was showing that where the average plastic exposure rating is 1 point higher on their scale, the CalEnviro screen score was about 6 points higher. Meaning they had higher poverty, higher percentages of greater than 25-year-olds without high school educations, and about 7% more Hispanic and 1.5% more Black, with being about 9% less white. In the areas that are most impacted in California, that number increases dramatically. About 16 points higher on the CalEnviro screen, 8% more of the population in poverty, and about 20% less white in those districts. So this is clearly an environmental justice issue, a racial discrimination issue. And to put it in health terms, which we'll talk about in just a second, for example, Kern County, where the majority of California's oil wells are, you have families that are living hundreds of feet from these wells. They're breathing in the toxic air that we've already talked about, with higher rates of asthma, cancer, and adverse pregnancy outcomes. And so these communities that are living near plastic production tend to be in areas where there's waste processing and disposal sites. So they are facing cumulative toxic exposures throughout the plastic life cycle. And we'll talk a little bit about those health outcomes on the next slide. So plastics themselves, like I mentioned, is a category, and about a fourth of those chemicals that are used to make plastics have known hazardous properties, and then 66 of them have never been assessed. So nobody's run any tests on these to prove if they are hazardous or safe. So the majority of things that are made of plastic, it's kind of unknown, questionable. All these chemicals were kind of grandfathered in. So in terms of how we are exposed to plastics, there's the direct contact that you have through packaging and, for example, things like microwaving plastics that leaks into your food. But also once these polymers break down, they turn into microplastics. And these are prevalent in basically everything. They are spread in soil, air, and water. They are found in tap water, bottled water, in oceanic environments. So they are particularly present in seafood. They've also been seen higher in honey and salt. So you are eating these, you are drinking these. Indoor air is a frequent site for microplastic contamination. And then even some cosmetics, dermatological products just have microplastics in them. So you are exposed almost in every stage of your life to these microplastics. And based on numerous epidemiological studies, it has been shown that workers in industrial, textile industries, plastic industries are highly exposed and often underprotected. And then children and infants are also considered a high exposure group. They have found microplastics in breast milk formula. We mentioned it's in the water that you would use to mix that formula, in addition to being in things like plastic toys and bottles. And with their higher metabolic rates and higher respiratory rates, they're at risk for all that kind of food and drink exposure as well, or in air exposure. We already talked a little bit about those communities that are at higher risk. California tribes particularly tend to be in these areas that are disproportionately affected. And when it comes to health outcomes, like I said, there are a few of these chemicals that we know are hazardous, things like BPA, but there are lots of others that we just don't have data for. But with the ones that we do know, there are negative effects on things like development, reproduction, the nervous system, cardiovascular, stroke events, heart attacks, and then decreased effects on the immune system. And as we develop more studies on microplastics, even the early studies suggest that they at least are contributing to things like immune system suppression in the gut, respiratory inflammation, and reproductive harms. And that's just early studies that have already kind of shown this damage. And for example, some other studies have shown that in areas of high plastic pollution, there's about 2 to 11 more annual emergency department visits for asthma per about 10,000 people. And the low infant birth rates are about 0.2 to 0.7% higher, depending on the degree of plastic pollution. So it is having large scale effects, and some of these we just don't know about yet. But California does have some plans in place to help mitigate this. We'll talk about it on the next slide. So maybe some of you have heard of it, maybe not. Prop SB 54 was passed in 2026, the California Plastic Pollution Mitigation Fund. And what this does is sets recycling and compost goal deadlines, basically saying that 100% of covered packaging has to be recyclable or compostable by 2032. There are kind of goals for plastic recycling rates and plastic reduction rates. And for our purposes currently with our advocacy, it also creates this plastic pollution mitigation fund. Which is estimated to be about $5 billion over the next 10 years. This is funded entirely by manufacturers through things like mitigation surcharges, interest penalties, and specific charges that are kind of deemed from this body that it's called the PRO, which helps implement this legislation. And what we're advocating for currently with our campaign is SB 1180, which is Senator Allen. This, like Rachel said, has passed through the Senate and is now in the Assembly and is currently in the Committee of Natural Resources, the people you just contacted. So keep those numbers or contacts. That would be maybe an ask for tomorrow, or if you're really anxious today. But what SB 1180 does is make sure that those funds address the full life cycle of the plastic production. There is a concern that industries really want to focus on that end product of physical plastic in the environment, and they really want to emphasize that part of it and a little less emphasis on giving money to things that might impact their production of plastics. So SB 1180 wants to add in that aspect as a formalized part of that funding. It also wants to standardize actions across the grant recipients, which for me is a sell right off the bat. What they're trying to ensure is that the research produced from these grant recipients is basically comparable across projects, so that the research can build upon itself and you can compare outcomes. And then, of course, they want to add in things like making sure these expenditures are achieving very specific purposes. One is prioritizing those disproportionately impacted communities, like we had talked about. That is a significant issue with this problem, with this pollution problem. And they want to make sure they're integrating meaningful community engagement and public education, and they want to support an overall reduction in plastic use. Another thing that the plastic industries aren't very excited about with this bill. This basically puts up guardrails and adds accountability to this fund, which has already been approved. Next slide. So what can you do in terms of SB 54 and the funding? All that funding starts in 2027. So they have already begun to kind of figure out where that funding is going to go. If you are interested in that part of this bill, there's a public webinar where they're going to go over their plan on July 8th. And then they also are currently open for public comment and feedback. They have some data that is up on that website that's in the link. My plan is to attend that July 8th meeting, kind of see what their plan is doing, and then maybe generate some public comments for August 14th based on what they're planning to do. If you're really interested and engaged, they have already had some community outreach events. There was one yesterday. The committee is very interested in getting community engagement, whether that be from people who are representing organizations or individuals themselves. So if you are in one of these areas with high levels of plastic or just concerned and want to help kind of guide where these funds go, you can definitely hit that link and see when they're posting their next meeting. It was actually a lot of fun and entertaining to kind of see all the different ideas people had for how to mitigate plastic pollution. In terms of our specific bill, SB 1180, it is up for a hearing on July 22nd. So if you are in the Sacramento area and have stories about your patients or populations that are exposed to plastics or personal experience with this pollution, come give some testimony. Or if you're in the area, we do have health talking points that I can supply you with to speak in front of these assembly members and give some arguments to why you would support this bill. And then, of course, like you just did, you can contact your assembly member. I've got a similar script to what Rachel had already given you. It's the same people, and we would be talking about this issue instead. Vanessa, you have a question?
Is it going to the General Assembly, Keegan? Is that what's next?
It has to get through this committee first. So the committee.
Okay, I'm sorry. Which committee is it?
Committee of Natural Resources.
Natural Resources.
The link leads to that one, and so it should be the same person that you were talking to earlier.
Before. I gotcha. Thank you.
Oh no, thank you. So that's currently where we are with this bill and in the process. But very excited. If anybody wants to get involved, let me know. And thank you for your time.
Thank you, Keegan. I think Michelle, passing it to you.
All right. Hello. Sorry, I missed the first half of this, but I'm Michelle. I'm working on a couple bills, one that's died and two that are still very much alive. So I want to tell you about them. The first one is this Josh Becker bill, Senate Bill 913, virtual power plants. This is not a new idea. It already exists, but it exists in sort of a piecemeal fashion. I'm here in Berkeley, and Ava Community Energy in Alameda County has a version of this. Richmond, California has a pilot. But this bill, there was an attempt to get this to pass last year as well. This takes and really coordinates this and makes it a bigger thing. It does a study and it kind of codifies how we can take this really promising idea of virtual power plants, which for me is one of those ideas that really feels like exciting and energizing, pun not intended, that we really have the tools to create something much better than what we have. And this takes all of these different energy resources that are distributed, somebody's car battery in their driveway. It takes all of these and it uses technology to organize them and plugs them into the grid at peak demand periods. And currently in peak demand, we switch on these dirty old natural gas peaker plants, as they're known. So this replaces that. It stabilizes the grid. When done right, it can really stabilize prices for consumers. So we have the technology. It's super exciting. This bill would really move us forward. An ask that I would give, kind of like California's, they already have a pretty successful rough draft of this called the Demand Side Grid Support Program. Came online in 22 and was supposed to be funded through 2028. And that just had its funding clawed back. So this is already something that this was already working and they're taking the funding away. So one ask that I would have is I can pop a link in the chat, and it is to let your people know that we really want to keep funding the DSGS program. It was working, and that is closely related, but then this new VPP bill will go even further than that. So I will pop this in the chat, and it's not a call. All you have to do is, it's a link to send in a comment on that. But yeah, oh yay, yes, Bill, awesome, yeah. So that's one ask. The coalition that's supporting 913 is asking that we also support this already existing program. A little bit more about 913 itself. It is already made it through the Senate. It's now in Assembly. It's going to be in the Utility and Energy Committee. So it's looking good. This one's very promising. So we're really hopeful to get this through the cycle. And I can say just a little bit more about virtual power plants if you go to the next slide. But all I'm going to say is they're very complicated. They take all of these, they're called DERs, distributed energy resources, and really are coordinating them in a way that makes it like, wow, we're the greater than the sum of its parts. So it takes a little bit of everything and makes everything better for all of us. So I'm really enthusiastic about this. And yeah, I could send out a link with extra credit if you want to contact the chair of the Utilities and Energy. That's the next hurdle for this, but making it already through one house is already very, very encouraging. Another bill I'm working on that's actually looking pretty good is this getting the toxic bisphenols out of receipts. And this is something, I don't know if you've ever been handed a receipt and the cashier, there's a sign right next to her that says, I'm handing you a receipt that's totally toxic. Here you go. You want your receipt? So this is just a common sense bill to take not only BPA, but also oftentimes the BPA are replaced by the BPS. None of that. Get that all out of our receipts. The receipts are bad for the consumer. They're terrible for the cashier. They also wind up in all these big paper bales and they mess up our recycling programs and end up contaminating kind of down the stream. So we just want to get these chemicals out everywhere we can. CDC shows that 90% of Americans have these in our systems already. Can we please stop having these endocrine disruptors, the health risks, infertility, obesity, cancer risk? So this bill has already passed the Senate Environmental Quality Committee as of yesterday. So I was really hopeful that I would be presenting this to you today and it wouldn't be killed yesterday. Passed. So its next step is the Senate Judiciary Committee. So I can pop in the chat. This is Chair Umberg in the next committee. This is on June 30th. So I don't know if we want to do these towards the end, or I can just put the list of the committee members in the chat. And if everybody wants to take it to call Chair Umberg himself, I can put the script. And then here's the list of everyone on that committee. If you happen to be a constituent of any one of these committee members, it goes a long way to hear from their constituents. So I can pop the script in here, and here's just a simple script. Any version of this. Do you want to save Senator Umberg's phone number for after this? We don't have to do live calls, but I can put that in here too. And then if you see that you live in a city where any of these other important opinions are representing, you can find your rep and get their contact info if you're in any of those districts. But yeah, and we're hoping this one passes too, hoping that maybe there's some across the aisle support for this, because it's not really a big industry that's making great money on this. So just get it out of our receipts. Yeah. Any questions or anything? Are we doing questions at the end? Hey, well, thanks so much, you guys.
Thank you so much, Michelle. And I believe our last presenter is Ashley.
Perfect.
There you are. Okay.
Yeah, I just put the links to the committees that Michelle mentioned. Should we take a minute to make those calls?
Sure. Yeah, let's take 3 minutes.
So maybe let's choose Senate Judiciary Committee, which is the one that is Umberg is the chair. So let's let Umberg know what we think. This is Umberg. number. And because he's the chair, we can all, you know, we have a reason to call him, even if we're not constituents. 651-4034. Can you see that? Oh, it must be my number thing. Hold on.
Can you put it in
So
the
it's
chat?
I'm trying. Yeah, hold on.
I put it in already, but I didn't put his name on it, Ashley. So.
Oh, I see.
Yeah,
Yeah, it's
the
this
916
one.
number I put in is Umberg.
Yeah. Okay, so let's call that
What's
right
the
now
bill?
and
The
ask
bill called again?
if you could.
Oh,
It's
1604.
Go back one. Can you go back? Yeah, exactly. So say yes on AB 1604, and then we'll come back in like 2 minutes.
Can you remind me who is Umberg, if he's the chair or she's the chair, if nobody is my
he's
okay.
Tom Umberg.
He's the chair of the Judiciary Committee that this bill has to go through.
Okay, thank you.
Yeah. Yeah.
Lou?
Hi, Senator Neal's office.
All right. We are making some calls. We are letting them know what we think. Thank you for setting that up, Michelle. So we're going to finish with, actually go back one, please. Yeah, perfect. So this bill I'm working on, AB 1790, that Assemblymember Connolly introduced, is kind of wonky, but it's called the Water's Edge. And it's basically, there's a tax loophole that multinational companies campaigned for really strongly under like Reagan. And it allows them to kind of decide how much of their income that they generate in California, how much of it they pay taxes on, essentially. So we believe that by closing this tax loophole for multinational companies, it would generate $4 billion for the state, which would be really helpful because of all the funding that has been slashed by the dark forces. So, you know, relevant for kind of our climate related work, we think that because, you know, as Keegan mentioned, California produces a lot of oil and gas and plastics. And in California, out of all these different corporations, the oil and gas companies, they would contribute around 100 million more in taxes that they're currently skipping out on. So super shocking. And the reason that we're working on this in Climate Health Now Action Fund is it's, you know, related to, it's kind of a polluter pay type of thing, but it's just really mega corporations should pay their fair share. They're paying probably less than we are in percentage. And I think it's also really important because we have a state budget deficit and because of all the cuts to Medi-Cal and healthcare and environmental, you know, protection funding. So we need more money and corporations should pay their fair share. So that's what this is about. And there's 3 ways to help if you think this is a worthy cause, which I certainly do. One is next Tuesday night on Zoom. There's going to be a meeting. This bill is being co-sponsored by Fossil Free California, but also SEIU, which is a really big union, which we're excited to be collaborating with. So they're hosting this power hour that I'm going to put a link to. It's at 6 o'clock. So, you know, there's that's the thing. I don't know why I can't put stuff in the chat, Whitney. Are you able to? The link to the power hour have been blocked from the chat. So that would be one way to kind of learn more about it, and then take action, like focusing on that for an hour. And that's in preparation for a lobby day. So if anybody wants to join me in Sacramento on Wednesday, July 1st at 9 a.m., free lunch, and we'll be talking to different legislators about the bill, why we think it's so important, why we think multinational companies should pay their fair share in taxes, especially to supplement the losses for healthcare funding and everything else. So that's one thing. And then the other thing is I was going to just actually put a link so that we're looking for co-authors on this bill. Currently, there's only a couple, and it's going to need really broad support to go forward. So I was hoping, again, oh no, I'm able to. So do you guys, does that link work? Hoping that you could call your assembly member, mine is Wix, and ask them if they, I did actually do this, ask them if they would consider, whatever your member is, consider co-authoring AB 1790, so Water's Edge, tax bill to make multinationals pay their fair share in taxes. Sorry, I didn't have this ready. So kind of getting more co-sponsors, or co-authors, I mean, that would be really helpful in building support in taxes. So if you could call your rep right now and just ask that question, that'll put it on more people's radars. And when I just called member Wix's, there wasn't a forum. He just said leaving a message asking for her to consider co-authoring it would be enough. So those are the 3 ways that you can help them pay their fair share. Co-sponsor, no, it would be co-author. Joining as co-authors. Am I saying it wrong?
Isn't it already authored though?
Yeah, but they're looking for more co-authors. There's like the principal author, which is Connolly, but more co-authors can join. Sponsors I always think of as like orgs. But anyway, you know what I mean. And they'll probably know what you mean. So let's take 1 minute if you could call them now, and then that might be what we wrap up with. Okay, so Rachel had to run. So thank you for doing that, and please finish up that conversation in your time. But then if you could, go to, that's perfect. So if anybody wants to join in, and there's plenty of opportunity, there's more coalition meetings than we can join. There's tons of opportunity to join in. So if you want to get involved with our awesome teams, that is the QR code that would help you, and there's a form in the chat to help out. So please do join. And then I see Rachel put in the chat, can we collate all of these into one thing? Yeah, totally. I think that is a really good idea, to share them out as kind of a list. And then, The other thing that we're doing this summer, and that we'd love you to join us in real person, is we're hosting potlucks. This is something fun that we do each summer, and this year the theme is around resilience. What does it mean to be resilient as a community, to be resilient as a, as different healthcare kind of clinics and hospitals, facilities. So we are looking for hosts and co-hosts to basically say, I'll make a reservation at this park, and I'll put together we have a spreadsheet to invite people to bring things to a potluck. And then we have a guide to help people kind of facilitate, a loose conversation, but a meaningful one about resilience. And say there was a heat wave and we didn't have power for 4 days, and what would we do as a neighborhood? What would we do as a community? So if you want to come to a potluck, if you want to co-host, or if you want to host, that'd be really great. I think we have about 4 in the works, but that would be a fun way to get together in person. And then we would, there's a handy form to share if you're interested. And I think, and then the last part for today is upcoming events. So next Tuesday, we have a meeting in which we're talking about the effort that the city of San Francisco and the municipal water and electricity, the utility there, they're trying to buy the electrical grid from PG&E. The PG&E, so far, there are 2 offers. They've said, oh, that's not enough. No. But I think this is a really cool story that needs help to be successful in changing from an investor-owned utility whose only goal is more money to making it a publicly owned company, which would really take away a lot of the obstacles to transitioning to clean, distributed, renewable energy. So this is a cool story that we could be a part of, and we kind of need to be to help it be successful. So that's next Tuesday at 12:30. Next Thursday, another in-person opportunity is, you may have heard that Trump gave $75 million to, I can't even say it, to bring in clean, beautiful coal to Oakland port, which really should piss all of us off. And there's a lot of dedicated, smart people who are working to oppose that. So there's a meeting at La Peña, which is a cool place in Berkeley, next Thursday night. And next Thursday at lunchtime, Culture Club is having the second viewing of these videos about drawdown climate solutions. So that was really went well last week, and you can join for that this Thursday. And then the very last thing is, this fall, we're offering a leadership development course in the form of a public narrative training. So how to tell the story of who you are, what you care about, why you care, in a way that expands your influence and helps more people want to work with you. So it gives CME and CNE and interprofessional continuing education. So lots of educational credits available. And if you're interested, we'd love to hear about that. I think that's it. That was a full hour. Good job, everybody. Thank you for presenting. Everybody did